Good morning. I hope you are doing well. Yesterday, if you remember, we had a lecture and we watched a couple of videos that dealt with the basic steps of auscultation, getting familiar with the stethoscope and the different anterior and posterior lung auscultation points and the various sounds that might be heard. Auscultating a patient's lungs may sound simple, but it's a crucial step in assessing an individual. As stated in your syllabus, the learning objectives and what will be assessed today is your ability to explain the basic steps involved with auscultating a patient's lungs, identify the anterior and posterior lung auscultation points, identify normal and abnormal lung sounds, and then perform a lung auscultation correctly during a head-to-toe assessment. As a quick overview, when listening to a patient's lungs, you want to have the patient sit up with arms resting on their lap, and you want to listen to both the anterior and posterior sides of the chest between the ribs, which is known as the intercostal spaces. Remember that the right lung has 3 lobes, the upper, middle, and lower, and then the left one only has 2 lobes, the upper and lower. You use the diaphragm of the stethoscope to auscultate at the various auscultation points. And you want to start at the top of above the clavicle and work your way to the bottom of the chest, mid-axillary. And you want to make sure that you're comparing both sides while doing so. Have the patient breathe in and out through their mouth slowly while listening. Make sure to allow the patient to determine how fast or slow that they breathe so that they don't hyperventilate, especially patients that have COPD. When listening, note that you want to make sure that the patient has a full inspiration and expiration cycle, and you want to note the sound's pitch, quality, duration, and if the sound is normal. So, does anyone have any questions before we perform our assessments?
No.
Okay. I've set you up with a partner because I was unable to obtain a mannequin today. If you feel uncomfortable, please let me know and we'll find an alternative for you. In a clinical setting, you want to listen to the patient's lung under their shirt, on their bare chest, but today we're just going to listen to, for the purposes of the skill, outside of their clothing. I'm going to let you practice for a few minutes and then I'll come around and watch you perform the skill and I'll ask you a few questions. Hi, Mars and Gabriel. Are you ready for me to assess your skill?
Yes.
Okay, great. Do you have any questions before we begin?
No, ma'am.
Okay, let's get started. Mars, you're going to be the nurse and you'll be assessing Gabriel's lung sound, so you can go ahead and have a seat and you'll be waiting for the nurse to come in.
Okay.
Hi Gabriel, my name is Mars and I'll be your nurse today. I hope you're doing well. I'll be using my stethoscope to listen to your lung sounds. I'll be listening to both anterior and posterior sounds, starting above your clavicle and ending mid-axillary on both the left and right sides.
Okay, Mars, what will you be listening for?
Well, I'll be listening for normal or abnormal lung sounds and comparing both sides.
What are some abnormal lung sounds you might hear?
Inspiratory or expiratory wheezing, crackles, stridor, or a pleural rub.
Good job. How many lobes does each lung have?
Well, the right lung has 3 and the left has 2.
Great. Go ahead and listen to Gabriel's lung sounds.
Deep breath in through the mouth.
You just come a little more this way.
Oh, okay. Flip your arm.
Okay, great job. And can you show me how to do the same thing posteriorly, please?
Can you turn around?
And sometimes it's a little easier if you have your patient kind of lean forward with their arms down in their lap so that they separate the shoulder blades.
Oh, okay. Deep breath.
Okay, great. What kind of lung sounds did you hear?
All normal.
All normal lung sounds, great. Good job. So thank you, Mars. You did a great job. Make sure that do you have any questions, first of all?
Don't think so, no.
Okay. Do you understand why we had him sit forward and separate the shoulder blades?
So you
Okay.
can see where to correctly put
The stethoscope,
the
yes. So hang out in the classroom because we're gonna have a multiple choice test that's gonna be online, so you can hang out and do some studying, speak with your classmates, and go over ideas, thoughts, how to remember some of the stuff, and make sure that you get your multiple choice test turned in by Thursday. Okay?
Okay,
Okay.
sounds good.
Great.
Okay.
Thank you.